My name is Latasha Lacey. I am a student at Allegheny College of Maryland. I'm in the transition LVN to RN program. Today's date is 10/3/2024. This is my patient, Mr. David Smith. He is who I will be performing my tracheostomy care on and suctioning on. I have gathered all of my equipment and put it in an accessible area. I have my 14 French catheter kit or suctioning kit with my sterile gloves and my cup in it. This is my sterile water. I have some extra gloves. This will be my bamboo bag, my oxygen, and I have my suctioning hose that is close by in hand's reach. So I've made sure that everything is accessible for the procedure. I will perform hand hygiene thoroughly. I will apply on any PPE, including gloves, gown, face shield, mask, goggles, anything that's needed as far as PPE. And PPE is just to ensure that my patient is protected from any type of infection or being contaminated during the procedure. I'm going to confirm my patient's identity by verifying that his name and date of birth is what I have. He is conscious, so he can let me know yes or no. Mr. Smith, is your name David Smith? He confirms. Is your date of birth 10/8/1978? He confirms. I'm going to explain this procedure to him, and regardless whether he is alert or if he's not alert, I will explain at this time that this procedure could be uncomfortable. There may be some discomfort, but it is to ensure that he has a clear airway. At this time, I will assess for respiratory status. I'm going to check whether or not he has low oxygen, any type of respiratory distress, any audible secretions, and at this time I do hear that there are secretions and suction is needed based on the assessment that I have that I've heard myself. Any type of pain, the patient, I would ask if he had any type of pain, and if he did, I would make sure to administer that prior to suctioning if that were needed. Mr. Smith, he is in a semi-Fowler's position, and if he was not conscious, I would have him be in a lateral position for unconscious. However, he's conscious, so he will remain in the semi-Fowler's position. I have placed a towel, which is a towel or any type of pad that has the waterproof padding underneath it. And this is just to protect his clothing or himself from getting any type of secretions on him. I have set my secretion device, the suction device, I've set it to 150 for adults. You would set these parameters at a different suction depending on the age of the patient. At this time, I will wash my hands, I will sanitize them, and I will open my suction package using aseptic technique. I will grab my cup, I will open it, only touching the outside of my cup, and then I will apply sterile water into the cup. At this time, I will put on my sterile gloves, and my dominant hand is what will hold on to the suction tubing. Well, my dominant hand is what will hold on to the catheter. My non-dominant hand is what will hold on to my suctioning tube. So at this time, I'm going to put on my gloves, okay? Only touching the inside of my glove. Uh-oh. Okay, and since this is my sterile hand, I will just grab here, and now that my hands are in sterile, I will fix my gloves, okay? All right, so this is my dominant hand, and this is my non-dominant hand. I'm going to reach inside of my suctioning catheter, grab it, and I will place it around my hand like so. Okay, leaving this little piece out. This is my non-dominant hand. I will connect the suction, but this time I'm going to perform to make sure that the suctioning is there, and it is there. I've confirmed that. So this is what I will connect. Remember that this is sterile, okay? At this time I'm going to disconnect the oxygen from my patient, and I've set it aside, and I will use my resuscitation bag for 30 seconds before suctioning. So, okay, so this helps prevent hypoxia during the suctioning process. At this time, I'm going to insert the catheter gently into the sterile water, and we're going to make sure that the water is suctioned. You know, just we can do that. Whoops. Okay, and it is suctioning. Okay, so it's working. At this time, I'm going to insert my tracheostomy tube without applying any type of suctioning. Okay, there's no suctioning at this time. Once it is appropriately in depth, it's going to exclude the Y port here. While withdrawing the catheter from there, I will gently rotate and the suction, and I will not suction for more than 10 to 15 seconds at a time, and this will avoid any type of trauma or oxygen depletion from him, but any type of trauma from the trach, from his throat. Okay. I will hyperoxygenate Mr. Smith again using my resuscitation bag for 30 seconds. Okay, 1, 2, 3. Okay, I'm going to release. I'm going to do this for 30 seconds. Okay, and reassess his respiratory status, his lung sounds, his oxygenation saturation. And you could do this, you know, multiple times if needed. If additional suction is required, you're gonna allow at least 30 seconds to a minute between the passing to perform no more than 3 passes into my patient. At this time, I will flush the catheter with the normal saline, and I'm going to dispose of it properly. Okay, replacing my suction tube back. I will just put this in here. I'm going to remove my sterile gloves. Okay, I will dispose of this and my PPE. I will dispose of all of it. And at this time, I will go and perform hand hygiene, and we will replace his oxygen back onto him. And Mr. Smith, we're going to check out his overall condition and respiratory status to ensure that he is stable after the procedure. And this concludes the detailed suctioning of Mr. Smith. I will ensure that my patient's comfort and monitoring his respiratory status after suctioning. And thank you so much for watching.